Neck is a part of bony body, or neck is a part of body on many vertebrates that connects the head with the torso and provides the mobility and movement of heads. The structure of the human neck are anatomically grouped into four compartments: vertebral, visceral, and the two vascular compartments. Within these compartments, the neck houses the cervical vertebra and cervical parts of the spinal cord, upper part of the respiratory and digestive tracts, endocrine glands, nerves, arteries, and the veins. The muscles of the neck are described separately from the compartment they bound the neck triangles. In anatomy, the neck is also called by its Latin name cervix or column. Although when used alone in context, the word cervix more often refers to the uterine cervix. The neck of the uterus. Thus, the adjective cervical may refer either to the neck or to the uterine cervix. These are structure compartments. The neck structures are described within four compartments. Vertebral compartment contains the cervical vertebra with cartilaginous disc between each vertebral body. The alignment of the vertebra defines the shapes of the human neck as the vertebra bound the spinal canal. The cervical portion of the spinal cord is also found within the neck. The visceral compartment accommodates the trachea, larynx, pharynx, thyroid, and the parathyroid glands. Vascular compartment is paired and consists of two carotid sheaths found on each side of trachea. Each carotid sheath contains the vagus nerve, common carotid artery, and the internal jugular vein. Beside the listed structures, the neck contains cervical lymph nodes which surround the blood vessels. Muscles and triangles. Muscles of the neck attached to the skull, hide bone, clavicle, the sternum, they bound the two major triangles, neck triangles, anterior and posterior. Anterior triangle is defined by the anterior border of the sternocleidomastoid muscle, inferior edge of the mandible, and the midline of the neck. It contains the styloid, digastric, mylohyoid, genioid, omohyoid, sternohyoid, thyroid, and sternothyroid muscles. These muscles are grouped as the suprahyoid and infrahyoid muscles depending if they are located superiorly or inferiorly to the hyoid bone. The suprahyoid muscle elevates the hyoid bone while the infrahyoid muscle depresses it, acting synchronously. Both groups facilitate speech and swallowing. Posterior triangle is bordered by the posterior border of the sternocleidomastoid muscle, anterior border of trapezius muscle, and the superior edge of the middle third of the clavicle. This triangle contains the sternocleidomastoid, trapezius, splenius, capitis, levator, scapula, omohyoid, anterior, middle, and posterior scalenus muscle. Nerve supply. Sensations to the front areas of the neck comes from the root of the spinal nerves C2, C4, and at the back of the neck from the roots of C4, C5. In addition, the nerves coming from and within the human spine, the accessory nerve and the vagus nerve travel down the neck. Blood supply in the vessels. Arteries which supply the neck are common carotid arteries which bifurcate into internal carotid artery, external carotid artery. Surface anatomy. The thyroid cartilage of the larynx forms a bulge in the midline of the neck called the Adam's apple. The Adam's apple is usually more prominent in man. Inferior to the Adam's apple is a cricoid cartilage. The trachea is traceable at the midline, extending between the cricoid cartilage and the suprasternal notch. From the lateral aspect, the sternomastoid muscle is the most striking mark. It separates the anterior triangle of the neck from the posterior. The upper part of the anterior triangle contains the submandibular glands which lie just below the posterior half of the mandible. The lines of the common and the external carotid artery can be marked by the joining the sternoclavicular articulations to the angle of the jaw. Necklines can appear at any age of adulthood as a result of sun damage, for example, or of aging, where skin loses its elasticity and can wrinkle. 11 cranial nerve or spinal accessory nerve correspond to a line drawn from a point midway between the angle of the jaw and the mastoid process to the middle of the posterior border of the sternocleidomastoid muscles, and then and hence across the posterior triangle of the deep surface of the trapezius.